the topic we are going to discuss today is a topic that sort of affects every area of our life. So number one, you'd find that when it comes to mental health, it affects how we parent, it affects how we relate with each other, it affects even our productivity. So for today, we are going to break down what is mental health, practical things and tips we'll be able to get today in this particular session. So to start us off today, Dr. Amadi, I think the question would be, to help us really understand this topic more, as before even we get into the details, what exactly is mental health? Because I know different people would look at mental health in different perspectives. In some setup, you'd say mental health. One would think about someone probably who's psycho. You say mental health. People have different definitions around it. So let's just check if your microphones are working, and then we could proceed. If you're all good. All good? Dr. Kendi? Oh, amazing. So Dr. Amadi, let's start with you. What is mental health? When we speak about mental health, what exactly are we talking about? And in this case, you're speaking to different people in the audience. Your mic is not working? Okay. You could use mine, and then as you sort that out. So what is mental health? And kindly someone help us sort this one mic out. Thank you so much.
All right, thank you so much. And thank you all for attending this session. Mental health is a state of well-being where one is able to cope with challenges or stresses within an environment, capable to learn, capable to work, and ability also to contribute to the community, and not necessarily just the absence of a mental health condition. So that is mental health as it is.
So if I hear you right, we're saying that mental health is the ability to be okay, to operate in all areas of your lives, regardless that you're not sick. Is that what you're saying?
What I'm saying is, yes, partly so, in the sense that you could have an individual experiencing or being diagnosed of a mental condition, but still experience mental health.
Thank you so much. Moira, if you could just chip in on the same, from a perspective of a psychologist, when you're speaking about mental health, what is that to a normal person, and how would they be able to relate to that, just that word, mental health?
I'd say it's how we feel, how we think, how we relate to other people, how we adjust to our day-to-day living, and the life's inevitable challenges. So just like physical health,
Right.
you know, we all have physical health.
Right.
Is it flourishing? Is it struggling? Is it languishing? So it's the same with mental health. So the question is not, all of us have mental health, of course. So it's the level at which you are at. So there are days which you wake up and you're thriving, you're on top of the world, your focus is clear, you're able to handle things, you are able to communicate, you can resolve conflicts well. And then there are days where you're really struggling. Maybe you can't get out of bed, maybe your mood is low, things like that. And then there are days where you're neither thriving nor struggling. We call that languishing. So you can say you're operating at 100, but you're not at the bottom either. So how I see it is the way your well-being affects how you love, how you communicate, how you parent, how you're able to go about your day, and are you safe for the people around you as well. So it's not just within us, it's also how are other people around us experiencing us.
Amazing. You've said something so powerful. The way we have physical health, we have mental health. And most of the times you find that we concentrate so much on our physical health and not much on our mental health. That's quite key. So we'd go to you, Dr. Kendi, and the question would be, back to what we said, when you say mental health, different people look at it with different perspectives. So from this particular setup, this is a Christian setup, what misconceptions would you say Christians have about mental health?
So thank you so much. So just to maybe mirror into what they have said about mental health, to bring in a different perspective is that you can look at it as the immune system of the mind. So sometimes you know that in the body we have the immune system, and we rarely even want to know how it's helping us and even safeguarding us from infections. And so the moment we are not taking care of our mental health, so that means something goes wrong. Sometimes subtle, we might not see it immediately. And so some of the misconceptions that people have about mental health, to answer the question now, is that sometimes when somebody is struggling emotionally, it means that they have weak faith or they are not praying enough. Sometimes also, there are people who think that being a strong Christian means that you can't be depressed, you can't go through anxiety, you cannot have mental health struggles. Also, I've seen in Christian circles whereby people have viewed mental health as being demon possessed, or somebody has been bewitched. And in other views, and maybe listening to people who consider that somebody going to even visit a therapist or a psychiatrist, that one means that there is a crack in your faith or something like that. So those are some of the misconceptions that I would mention. Thank you.
Amazing, and I think we'll keep discussing that as we go. You've said something also quite deep, that mental health, consider it as the immunity of the mind, right? I think that's something quite powerful that will stick with us. So in everyday lives, how would we be able then to distinguish when I'm stressed and when you're having a mental health concern? Mr. James, just help us take that up.
Thank you very much. Glad to be here today to share, conversations about mental health with couples. We in the mental health field are very, very excited that in most spaces today, we are having, whether it's in church, whether it's in organizations, interest in this kind of discussions. And of course, there's a lot of stigma in mental health for understandable reasons. So when there's this kind of interest, I think it's something that, you need your flowers.
Right.
Right. When we wake up in the morning up to when we go to bed, we are confronted by multiple factors that then impact what my colleagues have described as mental health or well-being. And as we confront, and of course at different capacities, as couples, as students, as people working in different capacities, and dealing with various life struggles or demands. One of the things that can help distinguish whether there's a struggle or whether we are doing well is how we function. And of course, one of the ways we function psychologically is through our emotions. So how are we navigating emotionally the various demands that we are confronted with as we navigate our day? How do we make decisions? Do we feel that the decisions we are making, we have the capacity to make them, or we don't? And over time, is there a pattern emerging? Do I feel like I'm struggling day by day? Do I feel like I have the capacity to respond to meet the demands and the stresses of daily living? If we feel then that, there's a little bit of, overwhelming, chronic, and, of course, not being happy or not being in a position to meet your goals, then perhaps that could distinguish, just day-to-day normal life stress that we all confront from something that then is overwhelming that then might need some further or deeper attention. Thank you.
Right, thank you so much. So as human beings, all of us have different levels of resilience. There's someone who can actually be able to accommodate quite a lot in terms of struggles or tough things they're going through, and there's someone else whose capacity is quite low. So if you're to try and explain it like in very simple terms, as if you're explaining it to a child, how would one say, at this point I need to see someone, or at this point I just need to probably add up or ramp up my resilience to be able to sort out what I'm going through? So at what point does one say, I probably need to see someone and get help, or I need to up my resilience and just figure out what I'm going through in my everyday life?
Well, good question. I would say there's a way we know ourselves, and for us here, we as couples, the way you relate to your wife or to your spouse, there's a certain pattern that you're used to. Now, if you discover that, for example, you're withdrawing from your partner, if you discover that you do not feel safe to discuss or to disclose what's happening, if you also, as my colleague shared, that we are used to physical health, but the two somehow interconnect. So if you find that you're also not sleeping well, you're constantly worrying. If you find that you're not as cheerful and you're not finding yourself in a position to pursue, the interest that you usually do, something is changing, right? And perhaps sometimes also people around us begin to notice that, nowadays you don't look yourself. You're not joining us, in, whether it's in, church, whether it's in, even at work, you're not joining us for lunch. Such perhaps begin to indicate there's some strain and perhaps something needs to be attended to. And sometimes not necessarily by us as professionals, sometimes it's just by, our couples, our friends, whether it's in church. So those are the early signs, but of course, as that continues and mitigated, things usually get a lot more serious. You begin to have thoughts, that are mostly negative. And of course, also controlling or managing your emotions begin to be a little bit difficult. Those could be indicators that, is not just normal day-to-day stress, but is something that I need, outside help. Thank you.
Thank you so much. So, Dr. Kendi, you mentioned that in Christian circles at times, having issues with mental health, at times it looked like your faith is not strong, or probably you're not praying enough. So my question would be, is it possible to love God deeply and still struggle emotionally?
Yes, it is. It's very possible to still love God deeply. Actually, to be what we say that sometimes in our circles we say, I'm a prayer warrior, I have a lot of faith. Yes, you can. And I usually tell people that in these circles, what actually affects people mostly is the shame that comes with maybe probably being seen as depressed or maybe seeking mental health services. And so I usually tell people that sometimes it's good to look at it like when we have like a tree and probably the weather becomes a bit shaky and the tree begins to shake. Remember the roots will remain. So it is our faith that actually anchors us, so that at the end of the day, we are not downtrodden. But does it mean that we cannot go through shaking? Yes, we can. So it doesn't mean that us being actually believers, that we are immune to getting mental health issues. And that is why I'm very happy about this conversation today. I will echo what one of our panelists here has said, that in these circles we really want to even talk about depression, talk about even just the name mental health scares people, even the name just a psychiatrist, visiting a psychiatrist. And that is why I'm happy with Ruach Tabernacle inviting us here today, so that we begin to now look at this thing and we help people to stop struggling in silence. Because you see, the shame, the guilt that comes with us not being able to seek help actually even worsens and makes us to even struggle more, even spiritually, struggle in our relationships, struggle even in our day-to-day activities. So I think that is it regarding your question. Thank you.
Amazing, thank you. So I think it's good that you're mentioning that you're happy to see conversations happening like this, even in Christian communities and in Christian circles. So in a setup like this in church, and this would probably go to Dr. Amadi, how are we able to set up structures, even within the church, to be able to encourage mental health conversations and also support? And in this case, we are couples in this place. And again, with marriage, there's a lot that goes on. There's the couple part, there's the children part, so there's a lot going on there. So from a church setup, what are some of the things you'd advise for us to continue doing to just keep encouraging and supporting these conversations to keep going on?
I think first, before I answer that, and tied to what my colleague, Dr. Kendi, has mentioned, I think it's best to understand we need to first demystify mental health with mental health conditions. Because everyone in this room experience mental health at different levels. It is not that we have mental health challenges with us, but we experience mental health the same way as the panel my colleague here has also mentioned that we also experience physical health. So in demystifying this is to say that one could potentially be mentally healthy, however, still having a mental health condition. For example, one could be physically well, but still have hypertension. It is well regulated, the blood pressure is within normal, but is within normal, yes, but still under medication, but he's physically well. Similarly, someone can be can be mentally well, experiencing mental wellness and mental health at a good state, but still have a challenge of possibly something like, let's say, bipolar mood disorder. So there are moments where they're in good mental state, but they still suffer a mental health condition. Now, to tie this in what structures we should put in place first is to, in demystifying mental health and mental challenge and mental conditions, we therefore have this society or community where we do not stigmatize those that have mental health challenges or mental health conditions. In this sense, because of the myths that are around us in terms of those that have mental health condition or challenges, that possibly they are either been bewitched or they are demon possessed, so they are ostracized within the said community. And therefore, for those that would potentially want to seek help, would in essence shy away from it and not necessarily come to the fore and get that help. And you see, when you have such kind of a community and you have children in it, they'll still pick up on the same thought process and thought patterns. So should a child or a teenager experience a depressive mood, as we see nowadays, even for teenagers possibly engaging in things like self-harm, would they be in position, are they comfortable enough to come forward even in this community to say, I'm struggling with my mood, or I'm struggling with this habit, or even engaging in things like such as substance use? Therefore, it means that the community needs first to destigmatize ourselves to the extent that we are much more inclined to air this out even in our community, and therefore getting that help as we go by. So the stigma within needs to now go down, in essence, by us demystifying what mental health conditions are and what mental health is. And I think in that sense then we will have a way forward here.
Amazing. So demystify what mental health is and provide avenues that all people, even different ages, can be able to come up and get help.
Yes.
Amazing. So one thing that is coming up very clearly is that mental health is something that everybody has. And the same way we maintain our physical health is the same way we should be able to do that for our mental health. And in cases whereby someone is struggling mentally, it does not mean that they do not have faith, they do not have strength, or they don't have resilience. They just need to get support and get back to a stable mental health, right? So let's get down into areas that affect the people seated down in this, the congregation or the group today, and that is family. So when you think about a mentally healthy family, how does that look like? How does that family look like? I want us for you guys to paint for us a picture of a family that is thriving mentally. How does that family look like? Moare, you could help us with that.
Okay. The misconception people have is that mentally healthy people are perfect. They do not cry, they do not fight, they do not struggle with communication, and so on and so forth. So I would say that's a misconception. I would say that a mentally healthy family isn't one that never argues or never cries or never struggles. It's a place where people just feel emotionally safe, safe enough to be honest and open, to bring their problems to each other and to know that their vulnerabilities are not going to be used against them, right? So if you have an emotional meltdown, for example, your kids need to know they're not going to be punished for their emotions, right? Or if conflict happens, it doesn't come with humiliation, because most times when people fight, they forget to fight fair.
Right.
So it's accusation, counter-accusation, insults and all that, humiliation, physical fights, altercations. It's also where, if there's a rupture, people are looking forward to repairing that rupture. There are apologies, there's meeting later to talk about things, there's commitment to follow through with repairing the situation. I'd also say it's a place where children can make mistakes without fearing rejection. They know, for example, if they're failing in school or at their sports, if they come home, what they're going to experience is not disappointment and rejection. Because one of the things we forget as parents is that children are also learning and trying, and they need to know that there'll be acceptance, unconditional acceptance, regardless of where they fall at in their achievements. It's also where adults apologize. You know, we've been raised, especially in the African setting, you don't tell your child sorry. You know, like how, you know, and when kids say you did not say sorry, you're like, what do you mean I did not say sorry? You're the one who's supposed to apologize to me. But when adults apologize, they actually model to children how to repair. There needs to be reciprocity, not just between adults, but between children and the adults. It's also where boundaries are respected. I find that we think to be a parent is to be, you know, it. You don't want to knock before you get into a room. You don't want to ask your child if you can borrow something. We model boundaries to each other, but also amongst couples, boundaries need to be respected. I find that people think that because now we are married or we are together, there are no boundaries between us, right? I can just take your phone and use it, or go through it, or I can get into your business. But boundaries need to be respected, and this is one of the areas in which people need to model that for each other. It's also where help is normalized, like seeking help is normalized. If I said, hey, I need to go and see a psychiatrist, the last thing I'm expecting is for you to judge me for struggling, right? Supporting your child or your partner when they are vulnerable and are needing help is one of the places in which we can normalize that, you know, being human is accepted here and we can seek help. But it's also where every member knows they matter. Not like some matter more than the rest, depending on your birth order or depending on your position in the family. So I wouldn't say the goal is a perfect family. It's just families that know how to repair, families that hold each other, families that recognize when they're isolating each other, families that teach how to fight fair, families that can discuss issues without necessarily turning them into taboo. That's what I'd call it. As long as someone is emotionally safe and security is sort of assured in terms of attachment.
Amazing. What I'm hearing you say is also from a parent's perspective, if you, the couple, are not okay, or you're not very alert in terms of how your mental health is, most likely you're transferring the issues you're having down to your children in terms of how you're parenting.
Exactly.
Right.
Yeah.
So Dr. Kendi, for families that are seated here and they want to raise emotionally healthy families and kids who are mentally strong and thriving mentally, what are some of the things you'd say they can start doing, even from tomorrow, even from today, to ensure that mentally their family is airtight and things are moving in the right direction?
So I think it still connects with what Mwari was saying, because I believe that for our children to actually feel okay and thrive fully, then that has to be a very emotionally safe home, where I'm allowed to express my emotions without being judged, whereby we see at the end of the day, even if, yes, we may go through conflict, at the end of the day, we are still human, but that conflict does not actually prolong beyond the time that it's required. Because we see, why do children actually struggle in families is when conflicts come, and we know that conflicts will always arise, but these conflicts are not handled like promptly. So that means that this child will always grow up knowing that at the end of the day, my family is not a safe space for me to be. And so the things that families can begin to do right now is to make sure that, number one, there is safety in that home. Safety in the sense that our emotions are valued, that at the end of the day, conflict also does not prolong. That is another thing. And the other thing is that an environment where I feel heard, that I am not suppressed. I am not told that the moment I try to raise an issue, it's like a taboo, I should not say some things. And I know that in this 21st century, tumetoka zile enzi za kale, where we can be able to voice out things without being attacked. I've seen a number of cases where we've had children who struggle, and sometimes now when we measure probably being okay with maybe the kind of academic excellence that we have, then that one is also not a very good measurement. So also we have to moderate. What is it for a child not being able to perform very well, but still emotionally they are okay? Doesn't mean that there is anything. And so we'll not have anything like parents being telling their children, wewe kichwa yako imejaa maji. You know, we have such things that, yes, ati hiyo kichwa yako hata inanga kitu. So we will not have such things coming even from us as parents to our children. Because I usually tell people that the moment you do that to a young brain, you're damaging it. And remember, our children's brains, they can only thrive and be able to maybe probably mature fully in a safe, emotionally safe environment. So it's like wet cement. The moment that wet cement is allowed to harden, and you know, sometimes we can only be able to manipulate things when people are young. So the moment this child grows up, anafika kwa teens and maybe late adolescence, then they will start struggling, and we wonder, why is my child behaving like this? It's because from Kitambo, they were conditioned that if this happens, this is what I should do. So children tend to withdraw. They tend to now become socially very isolated. And so for us to maintain safety, let me just say that, and for us to have these families that are okay, then I have to feel safe, I must feel heard, and at the end of the day, I am allowed to be vulnerable also. Thank you.
Thank you so much. I think you guys in your field, you have the patient-doctor confidentiality bit, but I'm just thinking, just listening to you speak, could you take us a little bit into your offices and tell us, what are you guys seeing based on how parents are relating with the children, based on the level of mental health in families? And after that, we'll go to the crowd and just get a couple of questions, because I'm told there are a couple of questions. I know this is a topic that most of us are super interested in, being parents here. So just take us into your offices and the things you guys get to experience and meet with couples, with families, with children. What is happening to kids based on how parents are relating to them in terms of their mental health levels, and how is it affecting the kids? Just give us practical examples a bit for us to just be able to understand this better.
Just a very recent case that I had of a grade 8 girl who has been suicidal for the last few months, maybe from around December. So the mother came to me, was referred by a psychologist, and the mother was actually very shaken and was never thought that the daughter would ever raise a mental health issue, not to even say that she's suicidal. So, and when we try to sit down and analyze where did this start from, because sometimes when we don't now look at the root, where did the issue start from, then we might not be able to help these people. Sometimes it's not just the medications that are going to sort out issue. I will say this, and I know Dr. Amadi, we like prescribing a lot, but I usually say that beyond that prescription, we have to look at other ways of actually handling this issue in a more mature way. And so looking at it, the mother tells me that she's a teacher, so she was transferred and had to go to, and that girl was around 4 years, 10, and so had to stay with the older sister. The older sister, who the sister now says, this is a don't care. So you can imagine now you've been left with this sister who does not care. Your mother is away, you're the two of you in the house, and your sister has a child. So you can imagine now this girl begins to be parentified at a young age. So she comes from school, she's the one to cook, take care of this sister's young son, and at the end of the day, she's supposed to also do homework, be able to wake up on time, go to school, you can imagine. So by the time she's reaching class 7 and class 8, she's overwhelmed. And I remember I told you that for children, the mind is very, in a way, peaks a lot. And so this is a girl now who has come to see that at the end of the day, nobody cares, nobody loves me. And so right now, she's actually struggling a lot. That's just one case example I can give.
Thank you so much. I know we'll delve into that much more when we discuss about children. So Mike, over to you to get a couple of questions from the audience.
Wow, thank you so much. Thank you so much, Joy. I'm here in the crowd and I'm looking at people looking so interested in the topic that we are discussing. Maybe just to set the mood for that Q&A session, maybe nianze na mimi, wengine wakifikiria ama wakiandika chini. And also just to mention, we have the QR code up there in case you feel you don't want to mention it and you want to ask a question anonymously. Please scan on the QR code, send it, and we'll be able to project it. Please note that that is for the anonymous one, wale ambayo hawataki kuonekana. But I'm standing here with the Lubekas, and they are anxious to ask this question. Karibuni, Lubekas.
Thank you so much. I'm happy to be here. My name is Maxwell Lubeka. I'm joined by my lovely wife of 5 years, Cindy Maloba Lubeka. In the interest of ladies first, I'll let her ask her a question and then I'll come in later.
Thank you so much. Like you said, I'm Cindy Maloba. I really appreciate the insightful discussion, and I have a question about boundaries in marriages. When Mwari was talking, I really loved how she dissected what mentally healthy families look like. She broke it down in a very simple, beautiful manner. But what caught my attention was the boundaries in marriage, specifically around phones. Maury, since a marriage is meant to involve openness, that's how I think about it, and becoming one, I really have a problem with phones, guys. So why would a husband and a wife really need to have phone boundaries? And how can we distinguish between healthy personal boundaries and unnecessary secrecy in marriages?
Interesting. Pini yako ni siri yako. Over to you, Joy. You want to answer that first?
I think Mwari would take that.
All right. Then whoever is next, just lift up your hands. We have a mic on that side and a mic on that side. Over to you.
Okay. I do understand the need for open communication, for involving each other in your lives. But there's this misconception that once I am with someone and I'm partnered with someone, my individuation goes away, right? Have you seen couples who, for example, Joy and Amadi here, if Amadi was a pizza person before he married Joy, and then one day I say, do you guys want to grab pizza? And then Amadi tells me, we don't eat pizza, you know? It becomes a we. But if I ask, by yourself, would you eat pizza? He might not be wanting to answer that question. However, deep inside, he knows he loves pizza. But what happens is that we start to borrow each other's preferences, we start to borrow each other's mannerisms, and over time what happens is that we lose ourselves, all right? So in so many aspects of our lives, I'm coming back to the phone, but in so many aspects of our lives, we feel like once you're with somebody and you've become one, as we are taught in the church, I cannot have my life and you cannot have your life. I cannot have my friends and you cannot have your friends, okay? When someone is snooping through my phone, right, the question I'd want to know is what behavior is driving that? Like what's beneath that? Because my phone and you going through my phone is a symptom, right? What is it that has led you to feel that you need to go through my phone? And I'm not saying go put pins in your phones and don't let anybody look at your phone, but could there be something that has happened recently, or is there something that happened in your past that has taught you that you have to snoop around and find out everything that's going on, right? So has your partner been having, let's say, some strange behavior lately? Like, is he going to the bathroom to pick calls? Is he coming home late and you think he's with someone else? Do you feel like he spends all his time on the phone chatting somebody? Has money been disappearing from your accounts and now you need to go through the M-Pesas? Like, what is happening? I just think the phone is a symptom. Is there something else you could be doing, for example, talking to each other or seeking help before we get to that place, right? Some of us also come from past relationships where either we were abused, we were controlled, people lied to us, people cheated on us, and since then, because maybe we haven't really processed that trauma or processed what happened to us, we have carried lack of trust into our other relationships. Is there a place where you can process that and perhaps together? In fact, one of the things I ask people who come for couples counseling is, what conversations did you have before getting married? Did you know what happened in the other person's life before? Did you talk about your childhood traumas? Because some of us also come from families where our fathers were controlling and there was a lot of coercive control. And he needed to know everything. They went through your journals, they went through your diaries, they went through your phones, and now you have brought the same behavior into your marriages because you have not dealt with your past correctly. Seek professional help, talk to a counselor, ask if you can go through the phone. But the idea that you can just get into someone's things without asking sometimes is just another form of mistrust. If you have an agreement that you need to go through each other's phones, that's also okay. My question would still be, why? I don't know, have I answered you?
I think.
Have I answered you? Cindy? Is it Cindy? You can ask me a follow-up question. I'm willing to answer.
I do not have a password.
You did not have a what?
A password.
Yes, that's
My
okay.
phone. Yeah.
Mm-hmm.
I really, I don't know. We should be easy. I don't know. Most people that I know do not have reasons. And I know that, okay, now I'm speaking for someone else, not myself, guys.
Okay.
Not myself. Not myself. Yeah.
No judgment here.
No judgment at all, but
Yeah.
just possibly to even just hope on what Mari is saying. Regarding phones, let me put it this way, just to simplify it. Would it be that even if you want to go through the phone, why don't you take it up in their presence? Why do you have to hide? Yeah? Of course, if you have passwords and all of that, you can just pick the phone, take the phone. If you want to look at it, you know the password, go through it in their presence. There's nothing wrong. If that will keep you at peace, it's okay. But like my colleague is asking, is there anything deeper than just looking at the phone that's making you go through the phone? Yeah. If that is not addressed, then you'll keep looking at the phone.
And not just the phone,
Yeah.
it will be other things.
Other things as well.
And I'm looking at a case in which, for example, Joy and Amadi here, our patients text us a lot, the way they communicate to us. I can imagine my partner going through my phone and going through conversations that are highly private, that are like I'm legally bound to keep conversations like that private, and yet for some reason, they are privy to my partner. Even if I trust my partner, I will have violated your trust highly as my client, right? So all of us, we do have other dynamics and other lives. Just because I shared something with Dr. Amadi doesn't mean now he gets to share it with Joy, at least not with my consent. And I know people think that because we are one, everything that's disclosed to me, I disclose to my partner, right? Right? People think that. However, in every single interaction you have in this life, even how we show up in our private relationships, those ones with your partner, with your children, that's how you show up in the world. With that level of distrust, you cannot trust other people around you. So my question is, what is it that's keeping you from going to your partner and asking if you can go through their phone? Listen to their concerns as to why you cannot go through their phone. But if I find that I want to snoop into my partner's life here and there, even put a private investigator on them, I already know the answer. Most times I already know the answer. Either they are doing something and I'm aware, or I have my own trust issues and traumas that I need to sit down with someone and resolve. Is that clear, at least? All right.
Mike, we could take one more question.
Hello.
All right, thank you. Mine is a bit different. There was a mention about your physical being versus your mental being. I'm an avid follower of, doing physical activity, going to the gym, engaging in sports, and sometimes I feel like it's a good avenue for you to also take care of your mental health, because sports, the competitiveness, the struggling to beat your past PR or whatever that you're doing, improving yourself day in, day out, as a good, or I think, what can we call it, an avenue to also strengthen your mental health. So I would just like the panelists to maybe dig through how we can, use physical activity, sports, to also enhance our mental health, generally as a family.
All right. Sawa. You inataka jibu say?
We could get the answer, and then we go into the next section, and maybe the rest would put on the Mentimeter. Maybe you could guide on that, Mike.
Yes, truly. So that, Joy, allow me, so that I don't look biased. I've stayed so much on the right. I just want to pick one from the left and then read one from the Mentimeter.
Sure.
So let me pick one from the other side, and then we can get a question from the Mentimeter. All right. Do we have any? All right. I believe this is Mrs. Mwenda. We are celebrating them. They are celebrating their 6th anniversary here with us today. Let us clap for them even as they ask their question. And congratulations on your 6th anniversary.
Thank you so much. I'm Millicent. I have my husband here, Abanas. Yeah, 2020, a day like today, we wedded. Amidst Corona, yeah.
All right.
So, my question still is about the discussion that we are having. I am afraid that our past really influences our present. And we are unaware. Yeah, most of the times we are unaware. Sometimes people have gone through losses, big losses. They come together, they love each other. Even the way their birth order, they are so different. We are so different. And my question is, what will couples do to make sure that this deep love that they have for each other is not affected by the past? And my second question, these days we have a different perspectives on family. So different dynamics, blended families, single families. I believe they are also families. How can people deal with that kind of family without really affecting the children? Maybe a blended family. Where will children be, and what can be done so that maybe their cohesion or how together they are does not affect the children? Because maybe they have chosen to be single. So speaking for that kind of setup, what will happen? Thank you so much. Abanas, you have something? Greet them.
Wow.
No, I'm okay. I'm in agreement with these questions, but so that I sleep well at home, let me just add on top of that. I'm following the conversations, and they are good ones. Now, I hear our panelists say, yes, we need to actually even apologize to our children. And looking at where most of us have come from, maybe, we were raised in a different way. I mean, even when clearly the parent was, there is a joke that people used to make that you don't lend money to your parent, because the moment you start asking for the money, they will now start asking, I brought you up, I did this and that. But now, in this era, I'm expected to give what I never received. So how do I transition from that parenting of 1990s to today? Thank you.
Wow. So those are two questions, I think. Yeah, there are three. So maybe we could start with the blended family one. Dr. Kendi, do you want to take that? How can people raise blended families that are mentally healthy and the kids are not affected because of the lack of cohesion thereof?
So I believe that by the time you're in such a setup, of course there are some conversations that went around, and you agreed how you're going to parent these kids. And so for me, I believe that there needs to be very open communication, a lot of, I think, emotional maturity, let me say emotional intelligence now comes in here, because now we are raising kids. These are, so there shouldn't be like any comparison in raising these kids. But I think that this is a conversation that probably we would benefit in another session, probably. I don't know well, but I feel like this is out of what we are dealing with at the moment. But anyway, in whichever setup, I believe that if there is that open communication, like agreements, you agreed, there were some rules that were set. This is how we are going to do things, not per se like rule or norms. This is how we are going to raise these kids. This is how we are going to do this. So I think that that one can help a lot in such a setup. Yeah, maybe Leto can add on to that. But before we go there, on the issue of the phone, I would say that probably it's a communication issue. I don't know, but probably you could look into that. It's a communication issue. That's why now probably you're trying to look into another, your spouse's phone, because maybe probably they have been quiet, they are not talking. And that's why now you need to look at how are you communicating between the two of you. It's also an issue of also emotional maturity, I believe. Because at the end of the day, it's not my part to really see what is in my spouse's phone and for what reason. Why am I even checking that phone? What am I looking for? Remember, some of us, we will get ourselves into problems for nothing. Unaangalia simu ya mwenzako, then you don't sleep the whole night. You become depressed, you become stressed 1 week. Utakuja kwangu, nitakuandikia madawa. And imagine you would have just talked, the two of you. Sindio? So some of the things we are experiencing actually, it's just lack of conversations among us. Sini ukweli? We don't talk, we are not open, there is no trust. So that is what now brews in these marriages.
Thank you, Dr. Well, it's not an accident that phone is a hot button topic. It will continue being a hot button topic for understandable reasons. Well, it's also important to have an idea what is the function of boundaries? What do boundaries do? The simple function or the major function of boundary is to protect self. Is not to be mean to anybody, is not to block anybody. The function of boundaries, whether they are financial boundaries, whether they are communication boundaries, physical, whatever boundary type, its main purpose is to self-protect. So, and boundaries are enforced through communication. So I agree with Daktari that kuongea, talking about what you feel comfortable with, what you don't feel comfortable with. And of course, there are varied situations where invasion into that privacy could be seen from a negative light. So sometimes it's case by case, sometimes it's, there are many dynamics to it. But it is in the era of phones, and as someone has said, we are living in a different time. Our parents who were from another generation never confronted this monster that we have today called phones. So today we find ourselves, having to imagine, having to be creative, having to navigate this new monster. Somebody also talked about fitness and well-being. Definitely. And earlier we started with how spirituality, how studies nowadays are showing more robustly that, belonging to a faith, daily prayer, goes a long way to improving our well-being, right? Because it even changes, and Dr. will confirm, it even changes how our brain works, right? So same as fitness. Fitness definitely, because it interacts with, our hormones, our blood supply. There are certain things that, endurance. We learn so many things through, fitness, because it's about stretching, our physical limits. It's about stretching sometimes even our emotional limits. Like, for example, waking up on a cold Saturday at 4 a.m. to go on gym and to do hits. I believe you do hits. However, fitness is not automatically wellness. There's so many other things, because there are people then who just use gym only or use exercise only, and then they say, as long as I'm going to gym, consistently, then I've checked all the boxes, I'm okay. That might not necessarily be true, but yeah, it's something that definitely has a big benefit to our well-being, both physical and mental. So that's I think what I would mention. And shortly, not to take all the questions, but she said something about our past, interfering with our future. And you're right that one of the things that even in our practices, what we see is people genuinely do not know. That our past, where we come from, our upbringing, our socialization, definitely contributes and has a bigger influence in how we navigate, the marriage space. And people do not know. So genuinely, a lot of people have no idea. The couples that we see in our practices, they get so surprised that how come I never saw this? How come I did not know this? Okay? And that's why we're very happy as mental health professionals to be invited in such fora, in such conversations, so that we expand because mental health and its benefits and how it does not belong to professionals. We do not we do not keep, wellness. It's in all of us. So when we have such spaces where we have conversations, we confront these things, doesn't mean that at the end of the day we have the right answers, but at least this conversation drives us somewhere. We get closer to more knowledge, more awareness, and that translates into better lives, better choices, and healthier families and community. Thank you.
Thank you so much. Mike, do you want to take one from Mentimeter?
Oh yes, I want to take one for the Mentimeter. I'm telling you, when the conversations are good, time flies. But let me take just this one. So this one wants to know, kindly talk about mental health after betrayal. And they're asking, is it possible to be a good partner or even a better partner after going through, or rather going through betrayal or being cheated on?
Who wants to take that? Okay, you could go, Murray.
And sorry, I know we also have questions regarding parenting which are streaming in. We will be having a parenting session in the afternoon. Thank you. Back to you.
Murray, do you want to take that?
Yeah, sure. The issue of betrayal trauma is a very tricky one because it's one of the things where you always have lingering questions at the back of your mind, and your nervous system becomes very sensitive that any little thing can trigger doubt, right? So maybe your partner cheated, or maybe you found that they have been having an emotional affair. It hasn't gone all the way. I always say, issues of infidelity, as much as we people of the faith easily see things as black and white, don't we? Like it's either do or don't. It's either vice or virtue, right? Most times when infidelity happens, it doesn't just happen in a vacuum. It's not just an isolated incident. There could be many factors that led to that, right? Sometimes it could be just that someone is in the habit of philandering, and these are issues that either we saw when we were dating and we thought they'd change, or they have never sought help, or they haven't taken time to work on the issues that lead them there. When this happens, and maybe you go and seek help, because I'm hoping you didn't just find out that your partner had betrayed you and you decided to handle it between yourselves. Because what happens is that they'll just say, maybe someone will say, pole, nimekosea, right? And then we move on. But there are deeper conversations back there, right? Someone just asked, some of us come from certain pasts. The certain past could be that the betrayed partner also came from a family where betrayal used to happen, right? Or the betraying party only knows that to be the only way to go through marriage. The question I ask everyone again is, what conversations did you have before marriage, right? And one of the things I appreciate about having this sitting we're having here is that this is collaborative, because a lot of times, when you go through pastoral training and you're leading a church, the way the curriculums are built sometimes is that the aspects that have to do with mental health and psychology will have one module and then not go deeper, right? So when we do premarital counseling in church, you may see a pastor for 4 weeks, but then there's much more to premarital counseling. And the mistake we make is that after we get married, we think that love is going to sustain everything, right? It's also okay to seek counseling professionally even after you've been married. So if you find out that betrayal has been happening and the two of you are in agreement and you want to, confront the issue together, right? Not to come and tell on each other, because people sometimes think when you come to counseling, you're coming to tell on your partner. You come and confront it together. And then we go through the issues. Sometimes you'll find that you may need to have counseling separately from each other, right? Like your own counseling and my own counseling, just to go through the issues and how this has affected you, or what is leading you to this behavior, and how you'd like to rectify it. Do people change and can they be trusted? My answer is yes. Yes, but only if they have insight, they're willing to learn, and they're willing to grow, and they're willing to keep repairing and not keep going back to the same thing. An apology is not enough, right? The best apology is when you show consistency in working towards growing and being transformed as a person. So yes, can you trust someone who's betrayed you before? Absolutely, if they're working on themselves and they're growing. I don't know if anyone else has something to add to that.
Maybe not completely related to what she's talking about, but it's the issue about somebody who asked about the past. I know our panelist here has really been able to highlight certain things, but remember, one of the things that can affect couples is not dealing with your past traumas. That is one of the things that I know, even in our offices. I know, Dr. Amadi, you've come across couples who individually, yes, they love each other, and the love is over the moon. Lakini, at the end of the day, we also have our own personal issues that we have to deal with. And I can assure you that these are things that can actually lead to even separation, to divorce, if not dealt with properly. And so I believe that if you're not able to address these things before you even get married, if there was no time for that, it's good to individually note what are the issues that I need to personally deal with from my past. Did I grow up without probably the love of both of my parents? Is it something that is affecting the way that I relate with my spouse? Was I brought up in a family that was very violent, that tukisikia baba yetu akiingia kwa nyumba, then all of us we hide? Imagine that one can affect you as an adult. And I usually tell people that some of these things that sometimes we think that we have actually dealt with by keeping quiet, that one does not actually solve issues, because silence actually worsens mental health issues. And that's why I like it that here it's a safe space. The other thing is that we have to be very cautious of our personalities. I know this is also another thing that we have to really deal with, even when it comes to all this. Sometimes we are all different, but we shouldn't blame personality when it comes to you not being intentional about your own mental health. So the message from here, I would say that each one of us, we need to know ourselves. Let us just understand what is actually driving the anger that I have. Is it from my past? What is actually leading to the way that actually I relate with my spouse, I relate with others? Is it from my past? Is it from the way I saw my parents deal with conflict, deal with my other siblings? Did I experience sibling rivalry? Was I probably even in school bullied? Was I maybe probably early in life, did I go through things like sexual assault and all that? I believe that we are supposed to be really open here, so that at the end of the day, we are able to highlight what can help us, so that we come out of here feeling a bit easy, and we can be able to go out also and become ambassadors, even to other people who are struggling. And I usually say that the moment you go through these issues, it makes you to be more empathetic rather than judgmental. Thank you.
Thank you so much. Those were amazing questions, and they are marrying very beautifully into our next session. We are speaking about couples and mental health. So I think I'll go to you, Moire, and ask this particular question. What are the signs that a spouse is struggling emotionally but not saying it?
It could be silent treatment. It could be withdrawing. It could be that they're sleeping a lot. It could be that you have noticed they're not eating as usual. They're not sleeping well. All of a sudden, their temperament has changed, or their mood is low. Sometimes it could be the things that gave you joy as a couple. So if you liked going, work out together or do fun things together, they're no longer interested in that. It could be that their demeanor towards their children has changed. It could also be that their preferences for a lot of things have changed, but there's nothing to explain it. Most times, these things don't jump on you, they crawl, right? Like the sadness doesn't just happen in a day. The changes start slowly, and then over time, they linger, and that's when you know that something is wrong. Even how they fight. If before you could talk and now they're just biting your head off, then you know they're right at the edge.
Right.
Yeah.
So, Mr. James, and what would make one of the couples just decide, I'll just suffer with my things silently. I'll not tell my spouse, neither will I go to get seen or get help. I'll just decide to do this by myself. What makes people do that?
Well, the biggest reason why people suffer in silence is perhaps they don't know, first of all, what's happening and what to do, right? And that's why for us, when people come to us, for whatever reason, the first thing is to investigate, what really is going on. And I can tell you 90% of the time, there's an aha moment. That now things begin to connect, the things they never thought about. So genuinely, people do not know. And why? Is because mental health is a new thing for us. I remember when and I'm sure my colleagues will also relate, when we were in college doing, this course, I remember even being asked, okay, now what does somebody do, once you become a psychologist? It was very new. It was, not something that people were aware. And then the other thing, the things you're talking about sound so Muzungu kind of problems, right? These are things we only see in movies, or it's relatable to, the white man. But I remember reminding people that at some point in the 80s and perhaps in the 90s, even some physical, ailments were seen not as, for everybody. Like, for example, diabetes was seen more as a rich man's, right? And perhaps because even how we used to call it, ugonjwa wa sukari, and sukari belongs to who? At least that was the perception then. And we have moved, obviously, today there's a lot more awareness, about some of these things. So the ignorance level has really dropped. So mental health is a fairly new space. So we don't have as much awareness about emotional things, personality things, all these things. And that's why now there's a lot of mushrooming terminologies that, is thrown around that it shows we are beginning to, have an idea. For example, words like narcissistic and all this, are now commonplace labels that, people are using. Why? It's something that is growing. And we are happy that with that increasing awareness, then it leads to people now beginning to ask themselves, okay, could there be a possibility that, I'm also, going through something that I need help, that I need to know much more. So a lot of people who come to offices, they get so surprised that we're able to navigate through conversations, and they're able to discover quite a lot. For example, I had, 2 weeks ago, I had a lady who came, And of course, because of internet and all these things, she had thought that she has self-diagnosed herself with, anxiety. But then as the conversation went, I realized what she was describing, as my colleague said, was just introverted personality type, right? That she's not as social, she, doesn't really enjoy a lot of, conversations with people, she's reserved. And for me that, fit neatly into introverted personality type. But then it has become such an issue to her that she thought, she had a disorder called anxiety. So from that, she was very surprised that I actually don't have a problem. It's just that I did not know a personality type of being introverted is actually like this. And there's nothing wrong with me. I just need to accept that I'm introverted. Perhaps if there are spaces that I need to be a lot more social, how can I learn to do that? If my work environment requires me to be a little bit more social, interact with people, how can I learn to do that? So in terms of why people suffer in silence, the biggest is that people do not know. And number two, they even do not know what to do about it. An example would be for us as men in the house, even in our couple situation. Through socialization, we have been told to suppress our emotions. Why? Because they are a sign of weakness, right? But then I had couples also, and the man kept on saying, asking, my wife, to listen to me or certain needs, that's petty, right? It shows a lot of pettiness. But then, when we do that, we are teaching our spouses, and especially our ladies, that we do not need. So eventually, when they ignore or neglect our emotional well-being, we also complain that, now I'm ignored, nobody takes care about me, But unintentionally, through socialization, emotions don't matter. So we communicate as if, that is petty, that only belongs to, the female world. And that teaches people to not realize that men also need comfort. Men also need understanding. Men also need, intimacy and love and all these things. So these are some of the things that then perhaps affect how, people confront these things, and then, they just suffer silently. Thank you.
Thank you so much. And just to tie that in, you said sometimes people do not know. Now we know. So let's say there's a couple seated in the session right now, and you'd find probably one of them is happy to get help, the other person is not. How do they navigate that situation? Dr. Amadi, just take us through that.
That's an interesting space to be in. But you would find that because of, like my colleague has said, socialization, or possibly have they been brought up, they don't deem the process to be important. So how to handle that is first to not make it an accusation aspect, in the sense that the other one does not want to do it, but rather it would be like, for example, if let's say one of the partners is probably depressed, they would have to bring it out as such that we don't enjoy possibly time together anymore, or we do not participate in certain activities that we used to enjoy, like probably we used to go hiking or we used to go bowling. We don't do that a lot more. Take me through what is it that possibly has made you not participate much more in some of these things. That would be one aspect. The other aspect would be to, like my colleague has said, grow. The one who's inclined into going in for therapy to possibly even start therapy for themselves, so that this would encourage the other partner to to see to it that if my partner is willing to go through therapy and they're actually growing possibly in the emotional intelligence, in handling possibly conflict within the marriage or within the union, that they will be inclined to say, I've seen there is a change in you and how you also handle the way we do things. How have you been able to handle this differently? And that in itself will also be an avenue to rope them into therapy or seeking assistance. Yeah.
Thank you so much. So to close this up, you say, Dr. Kendi, something very key, that mental health is the immunity of the mind. And for most of us, every year, you'll be told to do your annual checkups, you go and do your annual checkups, you do everything to ensure your physical health is functioning okay. What is that thing you'd be able to tell those of us seated here from a parent perspective in terms of the adults and also the children? What is this thing that we should constantly do to also ensure the mental part is well taken care of and we are healthy holistically?
So I would say that one thing that can help us is knowing that being mentally healthy actually is the foundation for everything. Why do I say that? Like when you see like this building here, okay, I know maybe probably this one, the foundation hasn't gone deep, so it's just a tent, but just figure out that it's a house that has a good foundation. So you can imagine if the foundation is not strong, that means the walls will be coming down, something will have cracks somewhere. So I usually tell people that when you look at mental health, we need to look at it as the foundation for everything. Because whatever that I want to achieve, the thriving career that I want to have has also to be based on good mental wellness. Probably also me being intellectually okay, being able to learn, being able to relate well with people has to do a lot with my mental wellness. So one of the things that we have really to look at even as parents is, how are my emotions? When I wake up in the morning, how do I go through the day? Do I do daily check-ins? Do I probably go even for just a mental wellness checkup? Because I usually say that, why is it that we will spend a lot of time just taking care of our physical wellness, then we ignore the very thing that actually drives everything in us, our mind. And remember, if you lose your mind, you lose everything. So I would say that let us prioritize good mental wellness, and even from the perspective of children, it's even better when we start it down there. So that as they grow up, we don't have to deal with issues that we could have dealt with early enough. Yes.
Thank you so much. So we've been graciously given an extra 15 minutes just to handle questions. And Mike, over to you to just pick out the questions from the audience.
Thank you very much, Joy, and the panelists. Thank you very much. The issue of mental health is really crazy, and I'm seeing people boiling, wanting to ask questions. So I'll do service. I'll take 2 from the Mentimeter and then take 2 from the crowd. So we'll alternate. I'll start with the 1 from the Mentimeter, 1 from the crowd, and then we'll alternate like that. Hiyo ni sawa? Crowd kama yuko sawa, semeni ye.
Yay.
Hapo sawa. Thank you so much. So I want to ask this. Given, this goes to the panelists, given that people are enabled differently economically, are there activities that people can be able to engage outside of counseling, assuming counseling in a kula kitu kwa mfuko? Are there activities that you can engage as families that can be able to help improve mental wellness within the family setup?
Well, yes, there's a lot that you can do to ensure that your mental health is indeed okay. I think the first thing is to ensure that you have a great or a good or a conducive environment at your home. If you have a conducive environment, then indeed that is one of the ways to take care of your mental health. And this is what I mean, that then when one is vulnerable in the family, be it your spouse, be it the children, that it will not be used at any one point as mockery. You know, like my colleague has mentioned here, when we say things like kichwa yako haina maji ama imejaa maji, vitu kama hivyo, matusi kama hayo, of course it goes a long way. It just deflating one's self-esteem. So if there's a conducive environment within the family where you're allowed to do a mistake, yes, but the way the mistake is rectified or handled is in such a way that it does not affect the person, but rather we are handling the issue as it were, not directing insults and all of that. Just having a conducive environment is one of the ways, because if you were to have a very toxic work environment and still have a toxic environment at home, you will definitely break. That is why we are seeing people possibly coming home late. We have seen people possibly staying in the car parks, just waiting until everybody has slept. Yeah, people going into the bars and staying there until late, until people have slept. Just because when they come in, it is more fire. When they go outside, there is more fire. So they don't know which hellfire to stay in or to stay at the abyss, so that there is a bit of tranquility there. So it's important to have a peaceful and a tranquil space within your home and ensure that your environment does that for you. That will go a long way.
Anybody wants to add?
Yeah, thank you, Dr. Ari. The other thing which would be useful to also consider is play. Studies after studies show, not just for children, but all of us, whenever we're in play mode, that space is the most relaxed, because play doesn't have conditions. You're not having any target per se. So having moments where there's play, and play could mean different things. It really changes how the brain mechanics work, because you have nothing tying you down. You have everything working in harmony, okay? And it's a great way to also relieve stress. And that's why you'll discover, even when you just observe children, once they're in play, like for example, there's now war in Gaza, in Middle East. But if you look at the camps, one of the things that is usually designed to take care of children is to create a play, multiple play situations. Yes, bombs are falling, but sometimes you see children just playing as if nothing is happening. And that is something that just doesn't impact children, even us as adults. So yes, we look for money. Yes, we try and grind and hustle and all that, but always create space where you tone down, where there's some kind of play, where there's some kind of relief. As much as we chase money, as much as we chase livelihood, there's also a space for that, and it can be done as together as a family. When as fathers, as mothers, we create that playful situation with our children, we discover quite a bit. It's a space for bonding, it's a space for connection, and even as couples, even in that bedroom, we can still be playful to each other. Thank you.
So much. Back to you, Mike.
Thank you so much. We have a question here.
Hello. Hi, everyone. I'm Kip. I'm with my partner here, Lillian. I have a question. You were talking about something about men and intimacy. So it's something I think men struggle with expressing their intimacy. You said something that men, they have these things, but it's assumed like they don't they don't need this emotional stuff. So I was asking about how do men bring up the emotional needs that they want, or at least they need from their partner? Because women are more upfront, they'll tell you everything, what they want and everything. But as a man, it's almost considered like simping when you start asking for certain things. You start regulating yourself, like, do I lower myself low so that I say maybe I like being held the whole night? What will that say about me as a man? So it crosses into identity. And also, maybe as men, we tend to downplay a lot of things. So if I bring up something to my partner and they brush it off or they take it lightly, it's rare for a guy to bring it up again. You'll just, move on. So over time, you find that you have this little stuff over and over, they're weighing you down. And as a man, you start withdrawing because your partner is not responding. And then your partner is accusing you, you never talk to me. You never tell me what you want. But we men, we say things in a very different and awkward way. It might just sound as a by the way, and that guy is serious. So how do we help maybe men to bring it out, what they require from their partner on an emotional level, an intimate level, so that this stuff, the emotional scars, don't pile up over time? Yeah, thank you.
We'll take that with Daktari. A good place to begin is, what is the function of emotions? Now, one of the things that emotions help us to do is to meet or satisfy our needs. It's through emotions. So that, for example, if you need to feel, as you said, an example of intimacy, the only way through that is to first accept that, as a human being, I have a need to, receive something. And that means a little bit of being vulnerable to your partner. Now, you're right, as men, we have not been socialized to feel vulnerable. We always taught from when we are young boys that, why are you crying? Man up, be strong, and confront things. So even the language that we are socialized with, because we need that language to communicate the needs or the emotional needs. So, and you're right, the language is very upfront, keep it short, be straight to the point, and that is mostly for problem solving, logical things. But then emotions, and even for our female counterparts, there's a lot of, nuances in emotional communication. They'll use their nonverbal, but for us, it's supposed to be straight, shoot, and move. If it is not there, then, disappear. So, and deal with the pain. But for men, I think what we need to unlearn is that emotion is part of our well-being. It's part of who we are. And emotions have a function. They help us to meet needs. They help us to communicate. There's no better communication tool than emotions. And finally, we are social animals. So social animals, one of the things that makes that interaction possible is emotions. Even if you look into the wild, if you look at elephants, for example, they are regarded as highly emotional animals. They grieve, they show affection, they show love. Why? Because of emotions. It's a very advanced function for elephants. Dolphins, I'm told, has the same. So if for us to function socially, and of course as human beings we have the highest level of social emotional functioning. If we drop the emotions, then we suffer. And how do we suffer? That neglect. So we've been socialized from a neglectful point of view. We have no idea how to need certain things, how to ask for certain things, and not just ask, persist in the asking. Our partners are very good at that. They have been socialized to demand it, to push for it, and that's why sometimes we feel as if we are overwhelmed because they are really pushing. They know how to negotiate for, for intimacy, for love, for all these things. Men, unfortunately, that's not what we have. But we can teach ourselves. We can learn to communicate to our partners our needs and be able to sort of also tell ourselves, I am not weak, I am not simping, because, I mean, how are you simping to your wife? I mean, she's supposed to be there to meet certain needs. Dr. Maybe you can add a few things.
Well, I'm just going to echo, but in this manner, to put it this way, let's get out of our comfort zone. We are stoic in how we have been brought up, like James has said, in this sense that we tend to suppress that which is within us. Colloquially, tutasema mwanaume ni kukaa ngumu. So all you need to do is stay there and look like you have it all together. But that should not be the case, and indeed, it should be that try as much as possible in getting out of your comfort zone to be free enough and creating that environment that you can start to communicate that which that you prefer. Because there are different ways of communication, in the sense that we as men would like to go straight to the point and not and give a lot of flowery words to it, but would want to say, this is what I want. And at times, it can be missed. It can be missed because, like you've said, when asking the question, that we say it jokingly. But we need to find ways in how we communicate to our partners or to our ladies in the way they would understand us. Yeah. So getting out of a comfort zone is what will definitely get us out of that space. Yeah.
Can I add something? And I think this ties, there was a gentleman who asked how you can give your children what you didn't have. And one of the reasons why we are all here today is because I'd like to think that we are changing generations, isn't it? So the deeper problem sometimes, to add on to Leto and Amadi's sentiments, is, I don't know how many of us have sons here. You have some sons, and how many of us have daughters, and how many of us have a mix of both. If your son falls down and starts crying, what's the first thing you say to that son? You're a big boy, okay? If a boy comes and tells you, I like this girl, and she turned me off, in kindergarten, because sometimes they start early, you have sons who are charmers and everybody likes them, and then one girl doesn't like him, and then they come and cry. You tell them to man up, If they rough each other in the field, we don't worry so much about boys by asking them to use their words to express that aggression, right? We teach boys from a young age that they have to be strong, and they have to be stoic, and they have to sit with it. What happens when your daughter falls down? We're like, Paule, oh, come here, sweetheart, and we hug them, and how are you feeling? And they tell us how they're unhappy. I mean, sometimes even when they're hungry, they will cry, right? And then we're like, oh, do you want a sandwich? For boys, it's like, use your words. Just say you want a sandwich. And the way we handle our kids growing up, in how we allow them to show affection, to express themselves, is very different in how we handle our sons and how we handle our daughters. In fact, when you have boys who have this really warm, cuddly heart, they want to be the ones giving you cuddles, and they cry when, a lizard has died, they cry when a pet has been injured. What do we call those boys? Sensitive, right? For girls, we say it's cute, don't we? So from an early age, we have conditioned our men to be emotionally constipated, for lack of a better word, right? But then girls, they grow up with the emotional vocabulary. So what do you think happens as you become a teenager and you become a young adult and now you have a partner? you carry on that way because, like it or not, our childhoods, they will forever take a front row in our adulthood. What we know as children, how we experience love, that's how we come to experience love as adults. So if I do not say, as the gentleman said, how am I giving my child what I didn't have? You're going to give that child what you didn't have because it is now up to us in our generation to put a pause to all the traumas that we have been perpetrating over the ages, right? Just because our parents told us to man up or be big boys or to, kangumu, doesn't mean we do that way with our men, because our young men, they're gonna grow up and they won't know what to do. So you'll find that even as men, and maybe this is a taboo subject, you'll find that people will be, and not to attach blame to partners, but sometimes you'll find that men will easily go to pornography because in their mind, that's easy access. And you'll find their partners saying, all he wants is just sex. All he wants is just sex. But sometimes, what this man is not telling you is that they're looking to be held. But we don't have the vocabulary for it because as we have grown up, our vocabulary, our emotional vocabulary has been highly limited, as opposed to your female partner who will easily ask for what they want emotionally, right? And if I'm finding someone else to talk to and easily express my emotions to them, then I easily gravitate to that person, right? So again, as parents, as people bringing up new generations, it is up to us to give them the gifts we didn't receive. It's up to us to put a stop to all these things that have been passed on over generations, and no, mwanaume si kukaa ngumu. That is why suicide rates are escalating. That is why mental illness is escalating amongst our men. And, we keep talking about how a boy child has been neglected. The boy child has been neglected. But who's neglecting the boy child? We are raising them ourselves. We are not neglecting them this time round. We're the new generation, correct? Yeah. So give your child, yes, that thing you didn't have. Start today.
All right, let's give the boy child love. Yeah. All right, sawa. My goodness, hatuwezi maliza. Lakini kuna moja hapa ametuma kwa Mentimeter na imekuja na please. So it looks like an issue that is reoccurring in most marriages. I'll just read it out. It says, how do you handle an issue that never seems to stop in a marriage and brings mental issue, hence making one start off releasing pain to the children unknowingly by scolding them all the time? I think the issue is not mentioned here, but I think it could be an issue of upbringing, childhood trauma, or even, something of the sort.
Yeah, so that's why I was saying that as couples, we need to be very aware of our emotions so that they don't interfere with the way we raise kids, because I believe that that's a parent who is struggling. Sorry. And this parent now who is actually now beating a child, and because they are struggling mentally, that one shows that there is a problem there. So I feel like this one, we need to probably go seek help, because at the end of the day, you see, you're causing more emotional pain to these children. There is this common phrase that we usually hear around the circles, people saying that hurt people hurt others, or wounded people wound others. And so there could be something that this person is going through. They are not able to verbalize it. And so the only way they can be able to now express the pain, express the emotion, is through now this beating or probably being chaotic. And especially, sorry, I will still go back to the main topic again. And that is why we have a big issue when it comes to gender and mental health. Remember, why are our men, probably even when you look at the statistics, we don't see them being like having depression rates high in men, but they are high in women. And it's because women are going to vocalize it, we are going to verbalize it, we will seek help. Unlike now, the men who are going now to internalize actually, and that one comes as withdrawal, as anger, and probably sometimes extreme anger that can even lead to you hurting others, probably substance use and all that. So I would say that we really need to be very aware of the emotions that are running in us and not be scared to seek help. Rather than now cause damage to innocent children, it's better we just take a step back and go deal with whatever that is affecting us. Remember this healing journey. It's a journey. It's not a one-day thing. And remember, you seeking help one day does not mean that you'll be okay in a day. But as you continue talking, as you continue probably getting to know what is really leading me to behave like this, then you're able to get the help that you need. Yeah, thanks.
All right, thank you very much, ladies and gentlemen. I think yangu imeishia hapo. Joy, you have any last sentiments?
Thank you so much, Mike.
Close. Yeah.
I think it has been a very, very amazing session. And probably just before we close, there's something someone mentioned on the question saying, what else can we do? Because there's also a perception that getting the mental health help is extremely expensive. So maybe to the doctors, is it inaccessible? Is it very expensive? What options are also out there for people to check?
Well, having an untreated mental health challenge or condition is much more expensive than actually seeking the help. It will cost you more if you're depressed in this sense. Look at it this way. If someone is depressed, they're unable to get out of bed, they're unable to eat, they're unable to do any chores. So if they're a mother, the children will suffer, the husband will suffer. If it's the father, the whole household will suffer because they're unable to go to work and fend for themselves. So the consequence thereof is that possibly income will be an issue, and therefore all the other things will definitely suffer. Look at it this way. If you seek help, probably get treatment for something like depression, because I'm mentioning depression because depression is a mental health condition that is treatable and curable. If this person seeks the care that they need, they get better, they are able to get out of bed, they're able to go to work, they're able to be emotionally aware and intelligent and handle the stresses around them better, then it means should there be challenges around them that they are able to now continue with their lives as it were. But we have also mentioned the things that you need to do other than just seeking care from professionals, like ensuring that your environment is also okay. Because if the environment that you live in is not well, then you perpetuate that the condition as it were, or the stresses as it were. My colleague has mentioned things like play, all right? We have also mentioned things like physical fitness or physical activity. Those are things that we can do in also enhancing our mental wellness, as it were, all right?
Yeah. Dr. Kenny, do you want to add?
Yes. So I would say that if we say that seeking mental help is costly, then what's more costly? Is it dealing with chronic stress that leads you to even cardiovascular issues, can lead you to diabetes, can lead you to even other probably conditions that probably you would have dealt with if you just went and talked to somebody and dealt with that stress. So I would say that it actually costs you more not to get that appointment. So beyond just looking at it as just a money issue, we need to look at what are the benefits of good mental health or good mental wellness. Because the moment I'm mentally okay, imagine I can be able to show up, I can be able to wake up on time. When I'm not okay, I tend to be just I tend to be just lazy, not lazy in that sense, but I don't want to do anything. That's when we say that you're depressed. I can't be able to even take a shower. You can imagine how much does it cost us? Costing us even in terms of lost work hours. These days, even in the corporate sector, I think they are beginning to understand mental health and mental health issues and how to handle their employees who are struggling. But remember, somebody who is struggling also sometimes can be deemed a liability, because the moment you cannot be able to wake up on time to go to work, you're not able to probably deliver on the work that you're supposed to do. So it costs you more. And again, if it's still about costs, remember, if you cannot come and maybe seek help privately, you can also do it. Public hospitals are there. I know Dr. Amade, probably we all work in the both public and private. And even in the public sector, you can be able to access good mental health services. So let's not run with this narrative that seeking for mental help is actually expensive. It's not that expensive if we know our why. Yeah.
Thank you so much. Thank you so much. This has been an amazing session. I have learned a lot. You know, I'm married to a psychiatrist, but I've picked quite a lot from this session, yeah? I'll remember, what conversations did you have before marriage? So if you want to go and do a review of those, it's like it will sort a lot of the things that we are going through. And the bit of your mental health is the immune system of your mind. I mean, that speaks quite a lot in terms of how attentively we should take care of that, even for ourselves and our children. Was that a lovely session for you guys? Did you learn a lot?
Yeah.
Please help me appreciate the panel. Thank you so much.